dear committee, dear audience, let me present my PhD work, the progress I have made so far. The title is, as mentioned before, Eating, Feeding Difficulties in Children with Autism Spectrum Disorder, from background to tailored treatment. My name is Krisztina Szalkay. I'm a pediatrician and a child and adolescent psychiatrist and work at Betesda Children's Hospital in Budapest. My supervisor is Kinga Farkas. My SMS is Rita 9. We have 3 ongoing projects. Our first specific goal is investigating feeding behavior features and sensory profile as early indicators of autism spectrum disorder by conducting a systematic review and meta-analysis. Why is this topic important? Autism is a more and more commonly diagnosed neurodevelopmental disorder with a 2.2% estimated prevalence. Early diagnosis is crucial in influencing prognosis of the disorder, as early intervention significantly improves cognitive and adaptive functioning of these children. With current screening practices, autism is commonly diagnosed late, and this leads to significant personal, family, and societal burdens. In order to improve early detection, novel approaches are needed that move beyond screening with uniform checklists at a single time point. Our study is focusing on 2 very earliest manifestations, the sensory issues and feeding difficulties, both of which occur at extremely high rates in autism from a very young age and can be permanent over time. The association between these factors by now is evident. The relationship is extremely complex. Multiple sensory systems are involved in the eating process itself. Both latest studies and our clinical experience highlight the importance of all sensory modalities. However, by now, no autism-specific patterns have been revealed. So, for that reason, we aimed to identify specific patterns of sensory differences and feeding behaviors that may serve as an early indicator of ASD. We set up 2 clinical questions. First, we ask, does the presence of autism in children result in more severe atypical sensory processing and feeding difficulties across different clinical aspects and across all 7 sensory modalities? The second clinical question is, can specific sensory processing and feeding behavior associations be identified that can serve as an early indicator for autism spectrum disorder compared with the typical development? We conducted our systematic search in 4 databases. After selection process, 46 articles found to be eligible. What is the reason that it is jumping alone? So I'm not controlling this, I'm sorry. So 46 articles were found to be eligible. So let me present my most relevant results. The first figure shows the differences in eating behavior dimensions between autistic and non-autistic children, using standardized mean differences in different eating behavior inventories. We can see that autistic children show significantly more and severe mealtime behavior problems overall and across 2 clinical aspects. The most pronounced difference can be observed at the limited food variety subscale. This specifically refers to the selective eating in autism. The other significant result is the disruptive mealtime behavior subscales. This refers to the typical features of autism. On the second figure, we can see the differences across modalities of sensory processing between autistic and non-autistic group. Autistic children show heightened sensory sensitivity overall and across all 7 sensory modalities. Interestingly, the most pronounced difference can be observed at tactile modality, followed by auditory filtering, seek sensation, and taste-smell modalities. The third figure shows the correlations between the severity of eating behavior and sensory processing difficulties in the autistic children's population. Plot A represents a significant but moderate correlation between the total scores. The plot B, regarding to the specific aspects, shows a stronger correlation for the limited food variety subscale and the taste-smell sensitivity. As far as we know, our review is the first from an early screening perspective in this topic, with a multidimensional approach, and offers a robust empirical foundation for the development of early screening strategies. The main limitation of the study is the heterogeneity of measurement methods and study designs. Unfortunately, age-based subgroup analysis wasn't possible due to limited data availability, and the lack of longitudinal studies limits conclusions on causality or predictive value. So we can conclude that autistic children show higher prevalence and severity of both eating and sensory problems, with a significant relationship between two aspects. Despite the notable overlap, the two phenomena are not interchangeable. For the best screening results, it is recommended to assess both areas. In practice, children with selective eating, auditory, taste, smell, and tactile sensitivities require close monitoring for autism, and future research should focus on establishing definitive early indicators of autism based on sensory feeding patterns prior to formal diagnosis. Identifying age-specific, screening-appropriate deviations in sensory feeding characteristics across developmental stages is also a challenge in the future. We have submitted our manuscripts 2 weeks ago, and now it's currently under review by Journal of Child Psychology and Psychiatry. Let me present our second project, which is strongly related to the meta-analysis. We started a nationwide survey about early detection of feeding problems and autistic features in Hungarian toddlers and preschoolers. The study is based on a clinical phenomenon that eating, feeding problems are commonly the first signs of autism, appear well before the onset of the traditional behavioral symptoms, and can easily mask the underlying neurodevelopmental conditions even for years or decades, leading to failure of appropriate timely diagnosis and early intervention. Our aim is to assess the prevalence of these autistic traits and the feeding disturbances in the general population and examine their potential association. We simply ask what is the prevalence of these difficulties, and we ask, is there a relationship between the severity of feeding difficulties and autistic traits? And we hypothesize that feeding problems show positive correlations with the severity of the early signs of autism. We target all Hungarian children between 1.5 and 6 years of age. We only exclude those affecting, those having some conditions or disorders affecting nutrition. We initiated the survey in March, and now we have more than 500 completed survey. This is my QR code, so here are the options for access the research. And let me shortly present the second project, what is basically the continuation of the second one. We are investigating the associations between feeding difficulties, autistic traits, sensory processing, and parental stress in early childhood. We are examining children with feeding difficulties in person by assessing ADAS, by assessing the autistic traits with ADAS measurement method, what is an objective measurement of autism. So here is a summary of my 3 ongoing projects, and I would like to thank you for your attention with brilliant thoughts of Winnie the Pooh from Piglet. From Winnie the Pooh, the things that make me different are the things that make me me. Thank you very much.
Thank you very much for this great presentation. This is the last chance for the audience to raise their hands.
Do you have a coffee?
Thank you for the presentation. I think it's a really interesting topic. I have 2 questions. One regarding the first project. You did the analysis between autistic and non-autistic pediatric population. Did you see any difference between female and male kids in the autistic domain?
Yeah, thank you. In general, male are overrepresented in autistic populations. So it was the same, but the groups were matched for age. So that's why it could be.
Thank you. And my second question is, I'm not in the field and I'm just curious, what would be the autistic traits that you mentioned in your second topic, in your second project?
Autistic traits, these are the early behavioral symptoms of rigidity and the social communication difficulties. There are standardized measurement tools for assessing this.
Nice presentation. I have a few technical questions.
Yeah.
In project 2, you mentioned there is an exclusion criteria for children who are not living with the parents. So what justifies this exclusion criteria?
Because surveys or questionnaires, what are we using? Are parent-reported questionnaires, so they are validated for parents. So that is this is the reason for that. Thank you for your question.
And gather that the eating problem or the behavior with the eating can be also overeating, or you refer to undereating?
Sorry?
So the refusal of the food, what you study, or it is also overeating as a problem with the behavioral pattern regarding eating?
There is an item about overeating as well. Yes, there is an item. Yes, it's important.
Thank you for your presentation. I would like to ask why is there fixed age range, just 6-year-old children, and why don't make it longer? Because I don't know the exact statistics, but I think there are lots of children who are diagnosed after this age.
Yes, because we are focusing on the early detection and the early childhood. This is a different group from many ways. So this early childhood is till 5 years of age, but the most important is that that is the reason that we would like to improve the early detection. And in all the world, it is elegant to give the diagnosis till 3 years of age. So this is so 5 and 6 years of age. It's a little bit late, and yes, but I know there are many children who give that diagnosis in adulthood, for example.
And also maybe for because the during the diagnosis process, parents are asked about early childhood and eating habits, and so it could be also for older children as well, if they remember, but they have to remember, because in the diagnosis process they have to give every information.
Yes,
and maybe it's
retrospective.
Yeah, it's retrospective.
Yes, it could be.
Yeah,
could be interesting. Yes,
okay.
Thank you.
Can't you combine it?
We haven't think about that because it's complicating enough focusing for this age group, but we will consider about this. Thank you.
Thank you.
Thank you for your presentation. My question would be that neurodivergence, so autism, and these are very fashionable topics right now.
Yeah.
Do you think this is, so in my opinion, it could be like a confounding factor, right? So maybe it's more, I don't know, common to diagnose earlier because it's a more talked about topic. Do you think this is a confounding factor? And also, what are the confounding factors that you are seeing present in your study?
The second one, so the research or in the manuscript, in the meta-analysis?
Either.
Confounding factors, I don't think so. The fact that now we are focusing on neurodiversity or neurodevelopmental problems brings that we can find these children earlier. So it's not an overdiagnosis. That I think it is not a confounding factor. What confounding factor can be is the cognitive level of both children and parents. Other diseases.
Oh, I see.
The social cultural differences, because in many countries the sensitivity level is not the same for doesn't eat something or selective eating. Yeah, that's and the other allergies, other pediatric conditions. So that
I think food culture, yeah.
Food culture is yes. So that's why I mentioned this cultural differences, because I've seen that looking at the articles that is totally different in Japan and in South America, and so
considering picky eating.
Yeah, picky eating. Yeah, what is the problem?
Yes,
actually. Yeah.
Thank you.
Thank you.
Any other questions? If not, I continue. Would you know whether medication would also influence this aspect of autism spectrum?
Yeah, it can be a confounding factor as well. Thank you. Yes.
But on both
lack of appetite,
as side effect or as desired effect?
I think a side effect. Lack of appetite can be a side effect of many medications. Yes, it could be.
But also in the sense of improving. So if the whole condition is improving by treatment, do you also see that this aspect of food disorder is improving, or is this somehow? It's a difficult question.
It's a very difficult question. That's why I so that it could be a great topic, because we recognize it in practice that if we don't treat autism itself, they don't eat. And if we start with the targeted developmental therapy, eating can be improving, but eating can be very rigid. And sometimes it moves slower than all other autistic features. So yes, it's a difficult question, but yes, it is essential for working with autistic traits to enhance their eating habits.
Thank you. Very, very interesting. Any other?
My other question is associating with the last question, but in another aspect. If ASD is combined with ADHD, how does, yeah, it's very common. So how does it affect the appetite and outcomes? Was it subgrouped or analyzed the data in the first meta like that, subgrouping with children who are not just ASD diagnosed, or
they were separately investigated. So the autistic group had only autism diagnosis, and in many articles they were compared with other neurodevelopmental disorders like ADHD or OCD or something like that.
Okay. And can it be also confounding when it is not diagnosed at the same time?
Yes, it's diagnosed later. Maybe it's an interesting question because ADHD children has also have sensory processing problems, feeding problems. So yes, it's an interesting question as well.
And one other question: what is now the what do we know if sensory problems exist just alone, or they are combined always with some developmental states?
Officially, we think that it can be stay alone, but in my experience, or based on my experience, it's always the combined clinical picture. So not so functionally. So the function is not so bad in many cases to give a diagnosis, but these traits we can observe these traits.